Hey Trey, how's it going? Good. All right. You got a quick question for me? Yeah, of course. So, you want to go over the second stage of labor? Of course. Now, what do you already know about the second stage of labor? Yes, you're right. It is when the infant is born. So, the stage starts when the cervix is fully dilated at 10 centimeters, and there's complete effacement, meaning that the cervix is stretched and there's thinning to 100%. And then the stage ends when the baby is actually born. So it's out of that vaginal canal. All right, so there are two phases that's in part of the second stage of labor, and it's based on the contractions. So there's the latent part, which is also known as the laboring down phase, and it's a period of rest and relative calm. So there's not really any like strong contractions going on in this time. The woman's pretty quiet. She may feel sleepy or tired. Um, and then there's the actual pushing part, which is the active pushing or descent phase. And this is when the contractions are significantly strong and expulsive, and the woman has the urge to bear down. And we can see that the fetal presentation or the head is moving downwards from that pelvis from a +1 to +2 to almost to even +4, based on the positioning of the head in relative to the ischial spine. And so when that happens, when she reaches even just +1, there's going to be oxytocin, which is a hormone from the posterior pituitary gland. It's going to be released, and that's going to lead to those strong uterine contractions. And when she's having these contractions, we want her to be focused on bearing down, so pushing that child. So she may be moving her position quite often so that she feels more comfortable during this time. The woman may be announcing that she's actually having those contractions, and you may hear her grunting or even screaming or swearing at this time while she is bearing down. And then the urge to bear down intensifies even more as the descent progresses and as the presenting part is reaching the perineum. So, signs that we can see that the patient is having an onset of the second stage is when she states that she has an urge to push or she may be having a bowel movement. You may even see sweat on her lip. She may have vomiting. There may be shaking on her extremities. She may feel restless and even say things like, I can't do this or I can't go on. And so, things that we want to do as a nurse is to assess the mother's blood pressure, her pulse, and her respirations every 5 to 30 minutes. And then for the fetus, we want to assess every 5 to 15 minutes its heart rate and pattern. Now, during that latent or laboring phase, as a nurse, we just want to make sure that the woman is positioning herself into a comfortable spot, and we want to encourage her to relax during this time so that she can conserve her energy when she's ready to push. And then we can also help with the progress of that fetus descending by helping the mother change her positions, do pelvic rocks, and even ambulating. Now, during that active pushing descent phase, so we're going to continue to help the mother change her position so that she feels more comfortable while she's bearing down, and to make sure she stays comfortable and give her any pain medications as needed or any other relaxation methods, and just continue to coach her, especially with her breathing as she's pushing during those contractions. And then we can also even offer her a mirror if she wanted to watch, and just make sure that everything else around that in her environment is calm and quiet. Any questions so far? All right, Trey. Yeah, that's a good one. So, what is the most important part of the nurse's role during the second stage? I would say it's encouragement. So, we want to make sure that the woman stays in control of her body. And so, when she's having a contraction, we want to encourage her to bear down during that time and to push spontaneously, not to hold her breath, because we don't want her to do the Valsalva maneuver because it's going to lead to less oxygen for herself and for the baby. So, if she is having a contraction, we want to enhance her self esteem and make sure she feels accomplished by all her efforts. So, it's important to encourage the woman to trust her own body and let her know that she has the ability to give birth to her baby. She may also say that she feels pressure or stretching, and that is part of her experience, and you want to validate that. You want to let her know that pressure and stretching that she's feeling is normal, because these are signs that the baby is progressing downwards out of the mother, and that her body is capable of having this birth. So basically, encourage her and explain what is happening and describe the progress that she's making. Now, another important point as a nurse to help with women is that she may not feel ready in her mind to complete the process and give birth to her baby. She may express doubts in herself to be a mother. She may be fearful, show anxiety, or feel embarrassed because there may be like unfamiliar experiences, especially if this is her first time in labor. So she's going to feel pain, and she may have uncommon behaviors while she's pushing, and that could be those screaming and swearing and groaning, and she may even have a bowel movement. She may also have fear that the baby will be in danger once the baby is delivered, because the baby is no longer protected in the uterus and is now in the outside world. So it's key to recognize that the woman may hold back from birthing her baby. So, as a nurse, we want to address her concerns and coach her during this stage of labor. Any other good questions? What about the woman's partner? Yes, so the woman's partner, whether it may be the father, maybe it's a doula or a grandparent that's helping out, their role is so important in supporting and encouraging her. So we want to encourage the partners to be present. They're going to change out of their clothes and put on some scrubs or a gown, and then put on a mask and gloves. And we want to keep the family together and close by so that both the partners can start the attachment process with the baby. And so once the baby is born, we want to watch for any signs of distress from the baby and then initiate those appropriate interventions. So we want to make sure that we assess the newborn immediately while the mother is holding her infant. And this assessment includes assigning an APGAR score about 1 to 5 minutes after the baby is born. So the APGAR score is used by it's a quick assessment of how the newborn is transitioning from outside of that uterus. So there's 5 things that we want to keep in mind, and there's a high score of 10, and there's 2 points assigned to each of those 5 signs. So the first one is heart rate, the second one is the respiratory effort, and the third one is muscle tone, the fourth one is reflex irritability, so is the baby showing any type of response when they're suctioning the nose or the throat. And then the fifth one is the baby's skin color, so is it cyanotic, is it pink, and basically we want a higher score. So the highest you can have is 10. So anything about 8, 9, or 10 is a good thing. Otherwise, we would have to go through more of like the intensive care interventions. So key thing is we want to do is maintain a patent airway, and we want to prevent any cold stress or drying from the skin. So you want to cover that newborn with a warm blanket and then place that child onto the mother's abdomen so they can do the skin to skin contact. All right. Any other good questions, Trey? Okay, let's go and check in with your patient in room 208. All right.